Hello and welcome. We never thought we would worry about AIDS. We thought it would be some rare disease which only affects homosexuals and people from the African continent. People around the world are rallying, forming human chains, organizing street plays, and conducting fashion shows to create awareness about AIDS. Approximately 14 million people around the world are currently affected with AIDS. In India, around 2.4 million people are affected. Tara is one among them. Let's meet Tara. Tara met with an accident a few years ago and needed a lot of blood. Unfortunately, the blood used for a transfusion was not tested for HIV. Do not think this is the only way to get infected with HIV. There are various ways of getting infected with HIV. One of the most common ways of getting infected with HIV is through unprotected sexual intercourse with multiple partners. Using needles, syringes, or other sharp instruments which have come in contact with HIV virus can cause HIV infection. HIV can also be transmitted through an infected mother to a child during pregnancy. Tara is in clinical stage 3 of HIV infection. Yes, there are different stages of HIV infection. HIV infection is staged on the basis of certain signs, symptoms, infections and cancers grouped by the World Health Organization or WHO. The first stage is primary HIV infection. At this stage, the infected person may develop fever, rash, joint pains, and enlarged lymph nodes for some time, or no symptoms at all. The next stage is clinical stage 1, which may be without symptoms or generalized swelling of the lymph nodes. The third stage is clinical stage 2, which includes minor weight loss and recurrent upper respiratory tract infections. Next stage is clinical stage 3. This stage includes chronic diarrhea, persistent fever, oral fungal infection, and acute inflammation in the mouth. Some persons with clinical stage 3 have AIDS. The last stage of HIV infection is clinical stage 4. This stage includes 22 opportunistic infections or cancers related to HIV. All people with clinical stage 4 have AIDS. HIV and AIDS. People often seem to confuse these terms. HIV stands for Human Immunodeficiency Virus, and AIDS stands for Acquired Immune Deficiency Syndrome. HIV is a virus that causes AIDS, while AIDS is a collection of symptoms, diseases, and infections associated with an acquired deficiency of the human immune system. The HIV virus impairs or destroys the cells of human immune system, leading to AIDS. With no immune system, a person may die from a simple infection, such as cold or flu. When Tara's neighbors came to know she has AIDS, they panicked and she was isolated. They thought the kids also would get infected with HIV if they touched or played with her. Fortunately, for her and her parents, Saya and NGO came to their rescue. Not many are so lucky. People with HIV are isolated by the society due to many misconceptions. Tara's neighbors were ignorant and didn't know the truth. Such misconceptions still exist. There are also many questions in people's mind related to these misconceptions. Let's check some of them. Does HIV transmit through casual contact? No. HIV cannot be transmitted by shaking someone's hand, hugging someone, kissing, using the same restrooms, or drinking from the same glass as an HIV person, or by being exposed to coughing or sneezing by anybody who has HIV. HIV only affects drug users. Is this true? In fact, HIV can infect anybody, regardless of age, sex, ethnicity, or sexual orientation. Anyone who doesn't take proper precautions before possible exposure to HIV can get infected. Can mosquitoes transmit HIV? Not really. Since mosquitoes feed on human blood, people believe that it can spread the virus. As the insect cannot be infected with HIV, it cannot transmit HIV to the next human it feeds on or bites. Is it possible to identify an HIV-infected person by looks? No, you can't. A person infected with HIV may look healthy and good, but he or she can still pass the virus through blood or sexual fluids. An HIV test is the only way to determine this. Does HIV survive only for a short time outside the body? HIV in small amounts of blood survives at room temperature outside the body for hours if dry and for weeks if wet. Can AIDS be cured? Although we can control the progression of HIV virus and stabilize the patient's symptoms through antiretroviral therapy, there is no cure for AIDS. Many claims have been made about curing AIDS, but there is no evidence to support this argument. Patients infected with HIV need our love and compassion. They should not be discriminated from the society due to these misconceptions. Help them to fight against HIV by providing care and support. Even though there is no cure for HIV, its progression in your body can be slowed down and almost halted with antiretroviral therapy. Many people with HIV are now living longer, healthier lives. Tara is on antiretroviral therapy. This therapy comprises the usage of 3 or more drugs known as antiretroviral drugs, which works against HIV by slowing down or stopping the reproduction of the virus in the body. If the virus reproduction stops, then the body's immune cells will be able to live longer and provide protection from infections. But medicines alone won't do any good. Like I've said before, HIV patients need our love and care. Tara could have been saved if appropriate measures were taken before the blood transfusion. There are various prevention measures that you need to be aware of. Knowing these might help you save others from getting HIV. Always ensure that the blood used for transfusion is tested for HIV and that blood safety standards are implemented. To limit the risk of getting HIV through sex, you should use male or female condoms. When used properly, condoms are an effective means of preventing HIV infection, both in men and women. Needles, syringes, and any other instruments that are intended to penetrate the skin should be sterilized before using. The risk of mother-to-child transmission can be reduced by treating the mother with antiretroviral drugs, cesarean section, and by avoiding breastfeeding. So, how do you know if you have been infected with HIV? HIV tests will help you detect the presence of HIV virus in your body. It is always advisable to get a test like ELISA done if you suspect you have been exposed to HIV virus. The 2 types of tests commonly used to detect HIV infection are ELISA and Western blot tests. There are many places where an HIV test can be done: a local health department, hospitals, pathology labs, family planning clinics, and sites specifically set up for HIV testing. It's always recommended to find a testing place where counseling is also provided. The counseling helps the person to cope with the situation and take necessary steps towards the future. Well, I guess I have to go now. Let's wish Tara all the best and pray for her. You must also spread the word and make people around you aware of HIV and AIDS. Let's make a difference. Goodbye.